everyone, this is Sarah with A Step Ahead Tri-Cities, and today in this video we're going to be talking about long-term acting birth control, or more commonly known as LARC. We're going to talk about three different types. We're going to talk about IUDs, or intrauterine devices. We're going to talk about the arm implant, and then we're going to talk about the Depo shot, or the Depo-Provera shot. We'll start with IUDs first. I have some examples of them here. These are actually hormonal IUDs. They're about 99.7% effective, and they're made of soft, flexible bioplastic. So you can see they're kind of bendable here. They last about 3 years. So these last about 3 years. And how they work is they release a hormone that prevents the woman's body from releasing an egg. So that's how they keep you from getting pregnant. Some side effects with these could be irregular bleeding, or some women actually don't have a period at all, so no periods. And then some women at first may experience some abdominal or pelvic pain. But those are the hormonal IUDs. We also have a non-hormonal IUD. As you can see here, this is the non-hormonal IUD. And you can see this is actually copper right here. Again, this is about 99.7% effective. And how it works is the copper acts as a spermicide in the uterus. So of course the IUDs, both the hormonal and non-hormonal, are placed in the uterus. This would be done during a visit to your doctor's office or your OBGYN's office. But the copper acts as a spermicide, so it actually kills the sperm, so you don't get pregnant that way. This actually lasts for 10 years, so it lasts for a long time, and it may be a good option for women who might be sensitive to hormones, because this is a non-hormonal option. Some possible side effects from this could be cramping. Sometimes a woman may report heavier or longer periods. What that means is if their period lasted 5 days, it may last 6 days. So heavier, longer periods, and there could be spotting between periods. So those are the IUD options, both hormonal and non-hormonal. There is also the arm implant, and the arm implant, I have an example of one here. This is what it looks like. This is about the size of it too, but it is soft, flexible bioplastic, so you can see it can bend just a little, but it is definitely durable. And it's placed just up underneath the skin, and it's placed in the arm, usually right about here. Sometimes you can see them in people's arms, and then sometimes you can feel them if you press down in somebody's arm. But how it works is it also releases a small amount of hormone to prevent ovulation. The arm implant is about 99% effective, and it prevents pregnancy for about 3 to 4 years. So again, this is what it looks like. Some side effects of the rod, implantable rod, could be weight gain, could be menstrual changes, meaning that some women may report that they might not have a period, or their periods may change. Could also be headaches or mood swings. So that might be some of the side effects from the implantable rod. We also are going to talk about the Depo shot. I don't have an example of that with me today, but the Depo shot is an injection given every 90 days, and it's hormones, and it prevents ovulation. The injection is typically given in the bottom. Unless you are over 250 pounds, then they may give it to you in your arm. It's 98% effective, so it's a very effective birth control method. It prevents ovulation, so that hormone that's injected prevents ovulation. And then it also works by thickening the cervical mucus. That way the sperm has a harder time getting through. Again, that injection you have to get every 3 months, so you have to make an appointment with your provider every 3 months to get that. So those are the 3 long-term acting birth controls. The IUD, which we talked about here, the arm implant, which is this one, and then the Depo-Provera shot. So those are the 3 long-term acting birth control methods. If you live in the Tri-Cities area and you're interested in one of these birth control methods, we can actually, through A Step Ahead Tri-Cities, we can provide funding for you to get this birth control methods, the long-term acting birth control methods. Doesn't matter if you have insurance or no insurance, we can help you set up an appointment and pay for the cost of the long-term acting birth control methods, so the IUD, the arm implant, and the Depo shot. And to make an appointment, you would call the number 423-415-0277. So that's 423-415-0277. And if you would like more information about these birth control options, you can also visit www.astepaheadtricities.org. All right, thank you for listening. Bye.